When I was really sick, I couldn't do anything. I couldn't walk up my stairs to my house, getting out of bed. Everything was debilitating. My life stopped, really. Since the transplant, my life has changed, done a 180. I exercise, I play with my nieces. You know, I couldn't lift them up before. I get to play with my nieces and I get to walk.
New England Donor Services allows me to live my life every day and be able to do all the things that I've been wanting to do for years that I couldn't do when I was on dialysis.
New England Donor Services is the nonprofit organization that is responsible for the coordination of organ and tissue donation in the region, identifying potential donors, doing the medical screen of those potential donors, working with families, the surgical recovery of the organs, and then the allocation of those organs to the patients who are waiting. The process of donation starts by a donor hospital making a referral to the organ procurement organization, in this case New England Donor Services, when there's a patient that has died at the hospital.
Hospitals are obligated to call us if a patient has suffered a traumatic injury, they have a low likelihood of recovery, they're on a ventilator, and we'll do a potential screen for donation. We're doing thorough testing throughout that time period to make sure that those organs are optimized for transplantation and that they're as safe as can be.
We are tasked with meeting with families, in some instances on the worst day of their life, to try and paint a picture of transcendence, discuss the opportunity for organ and tissue donation, and see if their loved ones are amenable to allowing their loved one to save the lives of another.
The thought that Kevin was going to live on was huge. It meant so much to us that he would have a legacy and he would live on in others.
I like to say that we're impatient optimists, that we're impatient for a future where there are sufficient organs and tissues for all of those in need. And we're optimistic that we can get there, and that really gets to the fabric of how we drive our work.
I really think that it's the people that make New England Donor Services special, and I couldn't be more honored to work with that team. They're just really well trained. It's really the bottom line. They know what they're doing, they're very efficient, they always put the donor family first and the recipients first.
What they do work that literally changes people's lives.
I can go in the middle of the night to any hospital in New England to operate on an organ donor, and having the ability to procure and transplant every single possible organ matters a great deal, and I think does lead to more organs being transplanted.
Aftercare picks up after the donation and assists the donor family with mailings, support, phone calls if they need to speak with us. A big piece of what we do is connecting the donor families and recipients, and we're really just there for the families for as long as they need us.
Both the man that got Kevin's heart and the other man that got his liver and kidney have gone on to walk their daughters down the aisle.
And become grandparents.
When I think of New England Donor Services, I think of a fantastic organization.
I think of community. Hope is the first word that comes to mind.
Compassionate.
Dedicated.
Caring.
Our work depends entirely on the donating public and the trust from the public that this system will deliver the life-saving benefit for patients who are waiting.
It takes a donor and it takes a recipient. And so we will never stop working to make sure that their lives are saved and enhanced.
Just one donor can help more than 75 people by saying yes to donation.
My donor family, I think about them every day. Every day. I don't know them, but what I do know is that a person that I have never met gave me the most amazing gift.